Again, my name is Angie. My pronouns are they, them. I'm on Dara Gland. I will be moderating today's webinar session. For those who need a visual descriptor, my background is blurred. I'm of Northeast Asian appearance and I'm wearing a black turtleneck jumper. Um, You'll hear my voice for a little bit at the start, but I promise that will change. Won't be my voice throughout this whole thing. I do want to acknowledge the traditional owners of the lands where all our offices are located or wherever you're videoing in from today, of the Gadigal people of the Eora Nation and the traditional owners of country throughout New South Wales where we live and work. As mentioned, I'm on Darragland. I would also like to pay my respects to the elders past, present, and any Aboriginal people joining us on this webinar. We recognize that sovereignty was never ceded, that this is, was, and always will be Aboriginal land. NUAA is a peer-based drug user organization, and we recognize the legacy of the peers who went before us. I like to say that we stand on the shoulders of giants, and we acknowledge the courage and commitment of the injecting drug user activists that play a key role in preventing HIV in Australia. We commit to holding their legacy and continuing the fight for the health, human rights, and dignity of diverse communities of people who use and have used drugs. Additionally, NADA proudly recognized people with living and lived experience of alcohol and other drug use, acknowledging their vital role in shaping policy, education, and services. We understand that their guidance, diverse experiences, and peer support saves lives and improves health outcomes. So yeah, if you've just joined us, I have some quick housekeeping to go through. As I already mentioned before, this session is recorded. If there's any tech issues, please feel free to put in the chat. I also have my colleagues Rebecca and Jawir who are present to help with any of that. This is a 1-hour webinar on the Language Matters Guideline version 2, the updated one. We will have a panelist of 4 that I'll introduce in a second and a Q&A at the end. As you can see on the screen, it's a NADA and NUAA collaboration. Please feel free to have your camera on. We love to see the audience, but also no pressure, whatever you are comfortable with. With any webinar topics, there may be some themes that are more triggering for some people, so please do take care of yourself in whatever way you need to. If you have any questions or comments, use the chat and be respectful when engaging with other audience members as well. Okay, so I'd like to kick off. We have a lovely and exciting diverse panel today. First up, Kate Johnson as a Living Live Experience peer leader from Lives Lived Well. We also have Dr. Rob Sterling, who's the CEO of NADA, Dr. Hester Wilson, Chief Addiction Medicine Specialist with the Center for Alcohol and Other Drugs, and Dr. Mary Harrod, the CE of NUAA. So to begin, to acknowledge that there's a version 2 of Language Matters, we have to acknowledge that there's a version 1, that there's the history of Language Matters. So I might shoot off to you, Rob, and if you kind of kindly explain the history of Language Matters and sort of the collaboration between NADA and NUAA, and I guess the reason why we've done the recent update.
Thanks, Angie. Yeah, I'll kick off and then I'll hand over to Mary because it is a collaboration. So the original Language Matters idea came from attending a conference actually in New Zealand. And you can see at the bottom of both versions that it acknowledges that this Language Matters has been adapted from first a US version developed in 2015 and then a New Zealand version in 2016. And we had asked Matuaraki permission to adapt it for the Australian context. And so NADA and NUAA have been collaborators and partners for most of the time that I've been at NADA. And so it made sense for us to collaborate together on this. And Cian, who was the NADA staff member at the time, worked with the representative from NUAA, and a range of focus groups were held both with workers as well as people with living and lived experience to understand what we might need to adapt for the context that we work in here in New South Wales. And that was how version 1 was created. So it was a process of engagement. In terms of why we're doing the review right now, I think it's important to understand that when we developed it not for people with living and lived experience. It was developed for people that don't have living and lived experience to give them the tools and the guidance for language that they should be using, because we know that language matters. Language is important and it can impact on a person's experiences of care, and it can also deter people from wanting to access care if appropriate language isn't used. NADA represents a really diverse range of services, both with a living and lived experience workforce. And so we had received feedback from people with lived experience, particularly of the fellowship, that it felt like NADA was saying that they shouldn't use that language, which uh, I think the back of the resource actually has a lot of contextual information, but we know for a lot of workers, and we see it when we go out to members, that the poster's up there, so they're not seeing the back in terms of understanding the context of why it's been developed. So we heard loud and clear from our members that, you know, we probably need to review this, and it's been over 5 years. So NADA and NUAA had a chat and pulled together a group to undertake that review, which is where we are today. That's probably it in a nutshell. Mary, I'm sure I've missed things that you'd like to add from that question.
Too much, Rob. Thank you. I guess that for me, there's a long history of this type of work within drug user organizations, and particularly input at that time was very involved in the discussion, and words like addiction and addict. And that was where our staff, it was Fiona Potter at NUAA who led this work and participated in a lot of the focus groups and the development work with Sion, and had already had like a keen interest in doing the work. So it was really like an ideal collaboration. And since that time, it hasn't really happened recently, but when it first came out, we had a number of people adapt it for their own local context within and outside of Australia, sometimes asking permission and sometimes not actually. But it kind of did spread far and wide from that first issue.
Awesome. Thank you, Mary. Really appreciate Rob and Mary what you've said. And it feels like a blink that Language Matters has existed for 5 years, but it has. So it's definitely overdue that we've updated and done a version 2. So I guess to all the panelists, but I might ask this question to Kate first. So why does the Language Matters guideline matter? Like why it's a guideline of importance?
I think when I, reflect on my experience of accessing treatment and different ways that I heard my experience described, I can really sort of pinpoint the points along the way where I accessed a service and instantly knew that it was not going to be the service that was going to support me to find wellness or healing, simply because of the way the words that they were using made me feel about myself and my experience. So, I tend to sort of lead with that in this space because I felt it and I've seen it and I've heard it. I've heard, horrible ways that we describe people who use services. So it's really meaningful to me and my community. And it's really lovely to see that it's been revised again and that it's creating more discussion.
Yep. Thank you for that, Kate. Hester, I see you nodding. So I was like, did you want to add to sort of why the Language Matters guideline is, why it's important, why it exists?
Look, I think as a clinician, it's important that us as clinicians are aware of the impact of language. So certainly me as a doctor working with people, I might use some language, and I've actually seen it happen where people have kind of gone, flinched, or there's been a shift or something, and so for me then to say, look, I'm really sorry, I've noticed that. Is it something I said? It's like, yes, Hester, it is, and so I'm really sorry, I didn't mean it, but it's, for us who are working in this area, we don't mean it, but it's the language is important. It impacts how interactions happen. It impacts on our therapeutic alliance. It impacts on how the person feels. And really importantly, I think for me as a clinician is understanding the way that stigma is internalized and gets in the way of people feeling like they deserve good care. So it's really important. And I first came across the Language Matters guideline when I decided to write a little bit about this for medical journals, and actually contacted Mary and said, do you think this language is all right? Should I write something? And wrote a paper for GPs that really looked at and used and credited and used Language Matter as well as other texts to really help GPs think about what language they can use and why it matters and how they need to shift it. And I'm still all the time I'm thinking about what are good words, and it's great to have the updated version. So I'm a little clearer on what words I can use, and at the same time, but also acknowledge that people may use language that is empowering for them, but I need to check, is it empowering? Do you want me to use the same language? Like, do I have a right to use that language that you're using? And so it just gives us a really good guide as clinicians so that we can step through this better to encourage and support people to access and continue accessing care.
Yep. Awesome. Thank you for that.
I think something else is that, sometimes, I think this is not about being judgmental of people either. It's about giving people tools, and that's what Language Matters is supposed to be about, because we often have biases that we aren't even aware of, that were created through culture, through media, through the way that people who use drugs are depicted in media, on television. And I think the other thing is we often have new people coming into the sector who may not know the right language to use, and think that it's okay to use particular language and not. So I mean, I think from NADA's point of view, this is really about giving some guidance to people. But yeah, I agree with Hester's comments. That's really good. Thanks.
Awesome. Mary, did you have anything else you wanted to add to that?
I don't think so. I mean, I think that just to go back to Kate's point initially, there's a lot of language that can be extremely triggering, that if you hear it, either in a personal or a professional context for people with lived experience that are working in this area. And it is actually a super helpful resource. And it's been circulated, like it was circulated before the drug summit. It's like we use it all the time, even in our own workplace. And it is actually a really helpful resource.
Awesome. Thanks, Mary. I think kind of what everyone has been speaking about is the power of language and the power of language being able to shape identity, dignity, and experiences. And I think what Kate kind of highlighted was sort of those personal lived experience. And Hester, you've kind of mentioned sort of the putting different hats on and thinking like a clinician and like really thinking about language, holding that power and and breaking that down. So I guess I'll throw this back to Kate. How does reclaiming language support people with lived experience to break down stigma and discrimination?
I think it's just about putting, I guess, or shifting some of that power back to us and how we want to hold the language. And I often think, in the context of 12-step and recovery sort of language, that traditionally was built out of mutual aid. It wasn't a medicalized sort of language. And so I think part of that is claiming back our power in those spaces and the ownership of that language, and then being able to provide further education to other people around the impact of that. I think it's been a bit of a process for us as a community.
Yep. Thank you for that. Did anyone else have anything to add to it? Or I'd be interested to hear from Hester or Rob, like, how do you approach these conversations, I guess, with colleagues or organizations or management who may not understand the importance of language, like this power that we're talking about?
Well, I mean, I think for me, I put it in my own personal context as well. Like, as a gay man, words like "puff" or "fag" have been used to make a community feel in a particular way. Whereas, for the gay community, some of those words are being reclaimed as a powerful way to describe ourselves. So, it's okay for me as a member of that community to use that language. But if someone else to say that word to me, it's generally to make me feel a particular way, which is not good. So I think it's around personalizing how you want to be treated with and spoken to with respect. So I think, having some of those little examples of what it means to you and the experience that it can have for you is really important.
Yep. Thanks, Rob. Did you want to add to that, Hester?
Once again, it's just really helpful as a clinician, kind of having a vocabulary, but also speaking to what Rob has said, that I can't assume anything. And I'm just noticing Kevin talking in the chat there, saying, you know, a doctor saying to him that he didn't look like an injecting drug user. And it's like, what do you expect a human being to look like? And it certainly is one of the things that's happened in my general practice, where people are accessing care there, and the receptionist will say some, you know, months down the line that I've been seeing someone to manage their you know, their health issues. Oh, that person's on methadone. Oh, I didn't realize they had a drug problem. They don't look like someone who has a drug problem. And I go, well, they've got a head and a body and 2 arms and 2 legs. Like, what do you expect them to look like? But it wasn't from any kind of place of malice. It's just that lack of understanding. I had a case happen a little while ago that I was just thinking about the other day, where one of my patients who'd been with us in the practice for a long period of time and had come out of jail, and he had some tattoos and a certain kind of haircut, and he looked a certain way. And I had this very middle class, straight down the line grandmother kind of receptionist. But one day when he was running from the train, he ran down the main street. He was picked up by the police. And they thought because he was running, because he looked a certain way, he must have been up to mischief. And he said, no, I'm going to my doctor's appointment. So they escorted him into our practice, you know, just to check that he actually had an appointment. And my grandma, middle class receptionist, was absolutely incensed that the police would treat our patient like that. You know, and so I guess it's just that thing around making assumptions. And the thing for her was that she potentially would have looked at that person and the way he looked and made a judgment. But he was our patient. She knew him. She'd had conversations. He was, you know, he was an amazing, unique human being, as people all are. And so that really shifted that sense for her, and certainly she's very aware of her language and what helps people to access care. But that really shifted it for her.
Awesome. Thank you for sharing that, Hester. I think it kind of goes into what we've been speaking about, sort of the stigma and discrimination, and how, you know, once we build that rapport, once we have an understanding of the Language Matters guideline, the importance of that, how things like we kind of shift our subconscious biases, and how that plays out in workplace, in practice. Yeah. Mary or Rob, did you have anything to add to that? Great. All right. So I guess the next question is sort of still based in workplace, because obviously we've just updated the version 2. Highly recommend audience members, if you haven't looked at the version 2 yet, please download it. If you've got it hanging up at your work, you can take that one down and put up the version 2. There has been some minor changes, as Rob mentioned earlier in the webinar. The second pager, which has all the content, is sort of some of the updates that have been highlighted. But I guess I'd be intrigued to kind of know, both from like Kate or Hesta, Mary and Rob, like when introducing the Language Matters guideline into the workplace, have you seen that the culture has shifted, or how is the uptake in that space with management? Is it hard to push through? Or I guess to the audience member as a call out, if they're going to champion this at their workplace, what are some things for them to consider? Who would like to start?
I'll start.
Awesome.
I mean, I don't know that the culture of our workplace changed. I guess that's like part of our interview criteria, basically, is like if somebody is using stigmatizing language, we tend to not hire them in the workplace. But the way we use it is, if we have a trainer come in, for example, we'll send them the Language Matters guide beforehand, and then it leads to like really productive conversations. So within our particular context, we like to be careful about who we're working with, so we don't expose our employees to stigma, and so we can use it as like a conversation starter. We did it with some trainers just recently and had a really good conversation, and also a really good training session as that resulted from, you know, they were great trainers anyways, like but it made that discussion and that training richer because they could understand where we're coming from as well.
Yeah, I mean, I fully support that as well. I think it's important at the early stages of employment because I think as an induction and orientation tool, it's really important. And I think, you know, for our sector where, you know, 50% of our workforce identify as having living and lived experience as well. I think it's useful as a conversation to understand and have those conversations as well about people's experiences and preferences as well, particularly if they have lived experience and that is their choice of language, that we all understand that and having that conversation. So I think, you know, as a tool, as a conversation starter, I think that's what Language Matters is all about. And I think the other thing that we've heard from some of our members, because I think in some of the early days we had, you know, some of our therapeutic community organisations who were resistant to Language Matters because as a TC, based on 12 steps, you know, the language, that's not the language that they use, and they're empowered by using the word addict and the other words that we've highlighted in the revision. And so we got asked a lot, you know, if we're being woke, and so CN and NUAA used to deliver some training to some of our members to, you know, kind of unpack and why it's important, and it's important for the workers. Like, this resource is developed for the workforce; it's not developed for our clients. And so I think having this as a webinar, on NUAA and NADA's website as well, to direct people to understand the context. If reading both sides, you know, people want to unpack it a bit more. So I hope this will be also a useful tool for the sector.
Thank you.
I'll just add from my context, so general practice, but also public health settings, whether that be drug and alcohol settings, but also general health settings, mental health settings, that this is an ongoing conversation. And certainly in terms of the people that we recruit into drug and alcohol, absolutely, you know, getting that language, thinking about language, and the Language Matters is part of our orientation, if people haven't already heard of it. And we do have some people that are shifting across to drug and alcohol from other fields or are new in their career, trying to get it into the training curriculum for people at TAFE and at uni, no matter what course they're doing. You know, to think about the power that it has and the impact that it has. But always, I'm always having conversations with people that I interact with around language. And, you know, really common ones is abuse and misuse and weird kind of diagnostic schmozzles because the diagnostic criteria have changed over time. And trying to find a way, because there's part of me that just look, I get a bit tired of it, and I don't have lived and living experience, but it's, you know, so how do you gently continue to have those conversations in it? And you know, and I would be saying, just flagging that some of those words you use can feel quite judgmental and stigmatizing. And the problem that we have is that stops people accessing care and staying in care and just makes them more unwell. So have a think about it. And here's the Language Matter Guide, you know, to support you to think about it. Because bottom line in with health workers, you know, as Rob was saying before, we don't mean it. We're there because we want to help people. And so having a really good guide that helps us to know what to say is just so important, because we do want to do the right thing, but it can be, you know, it's a bit like we're so enculturated that it just is how we do things. We don't think about it until we're encouraged to do it. So there is a really important role for us continuing to gently tweak and question and ask people and show them the Language Matters Guide to help them learn how to do things differently.
Awesome. Thank you for that, Hester. I'd love to know how it's going for UK at Lives Lived Well with the Language Matters guideline, how the introduction to the workplace culture has been for that.
So the guidelines are always received really well, and I think, you know, other people have spoken to it, that it's creating a conversation. So that's a really nice sort of place to start with organisations that are embedding peer workforces. You can't embed a peer workforce meaningfully into a workplace environment where there is going to be harm caused, because language used is going to directly impact that community of people. So I think I really love to hear that you guys are using it in your sort of onboarding processes. because it absolutely sets the tone for how peer workers will feel in your organizations, and organizations that, you know, meaningfully embed guidelines like this have much better outcomes for peer workers long term.
Yep, I really appreciate you mentioning that, Kate. I think sort of centering lived experience peer workers and the process of it all is crucial, especially with the version 2 of the Language Matters. The consultation process has been centering lived experience. Obviously, that's why it's a NADA NUAA collaboration as well. And I think that's something that like we really have to honor throughout. I think what I do kind of want to mention is, or kind of hone in on, I guess, is that we've really shed light of how the Language Matters is useful for clinicians. And I know for today we've had a lot of clinicians register for this particular webinar session. And I guess this might be more of a Rob and Hester question, but you know, Hester, you kind of mentioned before when engaging with people and centering the language that they use, but also being mindful and critical of the power of language and looking at the Language Matters guideline. I guess, is there a difference in the way that you're speaking with someone to build that rapport? And then there's obviously the other end of clinical practice, which is case noting or advocacy, or you know, so how does language come out in that? So both the spoken and the written, because I feel like that is sometimes where clinicians, you know, we're trying, it's code switching a little, for lack of better words. But I thought I just wanted to pose that question and be interested to hear on Kate as well, like how the LLE centers that within when supporting people. But yeah, Hester?
Totally. And so I think when I'm consulting with someone, and you know, they might use certain language, and it might be that it doesn't sit in that you know, use this language, but and so I'd be saying to them, just want to check with you. You've just used that word. Is that something that empowers you? Does it work for you? Does it make you feel good about, you know, yourself? Or is it something that's coming from that kind of sense of not being a good person that stigma creates for people? You know, I won't use that language because I think I need to. I'm a clinician. I need to use clinical language and very precise language and neutral language. But does that work for you? You know, please keep using that. Does it help if I use it as well to create you know, a space where we can talk? But generally I wouldn't. And so that is different to then having clinical conversations, case review, writing letters. In that, I'm very, very clear around using specific contemporary diagnostic language. And for me, that's from the ICD-11, for anybody who's clinical and thinking about that. The DSM doesn't work so well for me. The ICD, which is the International Classification of Disease, which talks about hazardous, harmful, dependent use, you know, makes a lot more sense to me, and it feels more neutral. That might not be right for everybody, but once again, we need to be using really precise clinical language so that people, and contemporary language, so that people know what we're talking about. I see a lot of abuse, you know, misuse, but that is old language. And so that's one of the things that I do spend a bit of time in terms of clinicians, talking to them about the updated contemporary language and the reasons why it's been updated.
I think that's a really good point, Hester, because the other thing about language is that it evolves naturally in society. So I think it's only natural that Language Matters is revised and will need to be revised again. And so I think that's important. I mean, you talked about case notes, and we have done a lot of training with our workforce around case notes, because we know that case notes can be subpoenaed, and we don't want to do anything that might impact on the health and well-being and the social futures of the people coming into our services. So it's really important that people are cautious about the language that they use, because when we're working with child protection and other legal system, we want to make sure that we're recording what is necessary and what is appropriate for the service that you're working in. And the final thing I just wanted to just make a comment on was around, Mary talked about, you know, the screening process when they're recruiting. And I think something that's really important about language, and you can kind of pick it up on people, and people who use or have used drugs are very good at picking up on the way people are speaking to them. And I think it's about intent. You can kind of tell sometimes when a person's intent is to make a person feel less than a person who's made a mistake and who's just using language that they've heard in the media or in society as well. And I think it's a good test, because that intuition, people who use or have used drugs are very intuitive, and they will absolutely pick up on the way that, the tones and the intent of how a person communicates to them.
And just following up from that, Rob, speaking with journalists or speaking with media, I've shared the Language Matters a document with the journalists that I sometimes do interviews, and if they are using language that is not contemporary, if I possibly can, doesn't always work with the shock jocks, but generally I don't talk to them because there's not much point. But just really encouraging them to think about the language that they use, because they are really important in terms of society and the way that people think about language, and also just in my social groups amongst my friends and my community, just gently suggesting the reasons why we use the language we use, and that language has power. And as you said before, Rob, it's the same in other communities, that the way that language is used is important, and so it's important here as well. So the Language Matters is a great one. I've shared it all over the place.
Awesome. Really happy to hear that, Hester. Kate.
Yeah, I don't think I have anything else to add. I think you guys have spoken to it really beautifully. I really loved hearing the way you were speaking about reframing that with people, Hester. It's a big part of, I guess, the work we do in peer spaces around helping people unlearn labels or unlearn, sort of belief systems that they've begun to internalize because of their exposure to accessing treatment. And yeah, just to that point that it's not malicious. We all do the best we can at any given time with the information we have. And so opportunities like this, where we can start to develop some more robust language that actually supports people to actualize their own strengths, it's a huge, huge benefit to our community.
Yep. Thank you for all that. I think what really struck for me, both from what Rob, you're saying, Kate and Hester, is that everything is political. Because like what you mentioned, with case notes and how this can be subpoenaed, this literally goes to our larger structural powers and like funding bodies, and how that really impacts. And case notes are political in the ways that we write about people and how we can support people. Hester, you saying, you won't speak to certain journalists who aren't good with language, because the way that they, represent language or speak about community members has a mass reach that has a ripple effect on government perspectives, behaviors and attitudes, and that shifts funding, so these little words, like you mentioned before, just taking out abuse, like it could just be a one word shift that actually has really strong impacts and a ripple effect. And that comes from speaking with people, but yes, as well as people that aren't living lived experience, other people as well, sort of having that allyship, but as well as in case notes, it's kind of, case notes are political in many ways, is what I always like to say. But yeah, I guess we have like a good sort of 20 minutes left. I would love to open it up to the audience if the audience have any specific questions, just because I think this discussion around the Language Matters Guideline has been really meaningful. But I know, like I mentioned, there's been sort of a diverse range of people that have registered today. So if there's any specific questions that have come through, please feel free to put them in the chat. So I can present that to our panelists. I do appreciate quite a few people have mentioned helpful discussion. Thank you. Absolutely agree with recruitment induction process, crucial to identifying stigmatizing language. We'll wait for some questions, but if not, I would love to know, as I guess the AOD sector, what do you see beyond Language Matters version 2? I'm sure NUAA and NADA are committed. Version 3, we will keep on top of this. We're committed to the process. But what else? What else would we like to see? What else would you like to see, Kate, happen in this space? Hester, Rob, Mary.
I think the thing for me is that we're never actually calling people out about their language. It's bringing them in to try and increase their understanding. And our peer workers are incredibly well positioned to do that, as people who have firsthand experienced the harms associated with poor language choices or practice approaches that centre around language that's not inclusive of our experiences. So yeah, I'm really excited for the future. I think it's a really nice space where our peer leaders can step up and try and provide, additional context to the why.
Yeah, I like that. I mean, I don't think shame is a place for learning. I mean, I think it's challenging conversations that I think need to be had, but it's the way that it's delivered, and support a person with the language that needs to be used is important. And yeah, thanks, Angie. I think that's really important to think about the future as well, because I know for one, the Aboriginal Drug and Alcohol Rehab Network is looking at their own adaptation of Language Matters to talk about how they work and communicate a language for Aboriginal and Torres Strait Islander people. And I know that Mary and I have talked about young people, and young people have their own language that evolves way quicker than us older people. So that one might be a bit more challenging, but I think there's definitely opportunities to continue to improve. And I think NADA and NUAA are really open to receiving feedback on how we can improve and what we might need to look at in the future, or support other people who might need to develop language for their own community as well. Language guides, not language. Yeah.
The great things about Language Matters is and what I've seen over the 10 years that I've been in this role is that it's a really evolving conversation, not just about language, but about stigma more broadly. And in that 10 years, I mean, there were very few peer workers, identified peer workers, at 10 years ago. There were a few scattered here and there. So that's one example of how things have changed. We now have a health minister that actively talks about stigma. We have stigma as an indicator in at least 2 strategies, BBB strategies, but like the whole discussion has expanded exponentially in that time. And I think that talking about language gives us a way to frame that discussion and make it more concrete, because that is where, there's a lot of ways and structural stigma, and, it takes a lot of different forms. But this is a really clear one, and it's a really, it's a very important conversation starter, I would say. I love the idea of Hester out there on a bit of a crusade, and I also empathize with like getting like all becoming a bit much at times to have those discussions. I don't always have them. I'm like, oh, I'm not at work, and because people use you don't always want to in my personal life, I don't always want to have the discussion, to be honest. So it's important also to sort of cut yourself a break. It's very situation specific.
Yeah, absolutely, Mary. And I think it's okay not to, and you've got to be in a position where it's safe to. There are some situations where it's clearly not safe. So and I guess I don't have a job which is, I'm not a peer worker. I don't have lived and living experience, and so I'm in a way I'm a kind of a bystander, because it doesn't affect me in the same way that it does other people, but it does, because I know it affects the people that I see, and that my core role as a doctor is to help people have the best lives they possibly can, and so it does matter. But yeah, you're absolutely right. It's okay to take a break from it and let it go. But yeah, the more that we have resources like this that are, it's such a calming resource too, with the nice colors, and try this instead of this. It's just really lovely and understated, and not shouty. It's great. So it's a great one to have. And I was just looking at Tracy's question, does this need to be rolled out beyond drug and alcohol? Of course it does. Of course it does. And so that's one of the things that we do in my local health district is, have conversations with the people in the emergency department, our mental health colleagues and our ambulance colleagues and our colleagues working on the wards. It's an ongoing story, and it's just part of it's. I think for us as drug and alcohol workers, it's part of our advocacy. It's part of our role.
I do want to make one comment on Tracy's, on Tracy's comment, and that is that there is an intention, when they're rolling out the single digital patient record. So I don't know how much people know about that, but that's going across New South Wales Health, over the next few years. And there is an intention to actually roll out training for every New South Wales Health worker. So all 150,000, and there's an active discussion going on about what that looks like. But so that's kind of a measure of the impact, not just of the work of organizations like NUAA and NADA and individuals like Hester. There's a lot of organizations that have been discussing these issues, like mental health, HIV positive, sex workers, LGBTQ communities have all been having these discussions for a long time. And that rollout is like a really great opportunity to try and create system-wide change.
Awesome. I really appreciate, Mary, you mentioning that sort of that higher level across the board, that it's intersectional in many, many ways. Did you have anything to add to that, Rob, in terms of like from a NADA perspective in the advocacy in this space outside of AOD?
Yeah, well, I think it's really timely in anticipation of the New South Wales government responding to the Drug Summit report, and something that, NADA and NUAA and many others have been advocating for. Excuse me, is that whole of government strategy, those intersections between child protection, family and domestic violence, out of home care. It's really important that we work collaboratively, and sometimes language is that bridge between those sectors as well. So I think it's really important that we educate to others, including law enforcement agencies as well. So I think it's definitely really important.
Yep. We've just had another fantastic question come through by an audience member. How do you address language barriers for culturally and linguistically diverse individuals? How do you communicate this to family members as they can influence individuals' engagement with the service? I think that's fantastic because the AOD sector definitely has a long way to go working with culturally and linguistically diverse folks. But I guess I'll throw it off to you first, Kay, and then maybe to Hester.
I completely agree. We have a really long way to go. It would be very nice to see the guideline rolled out in multiple languages. That could be, a potential solution. I think though, in general, like teaching our staff how to use Google Translate and to work with people they're supporting to utilize those sort of translation tools that they may not necessarily know exist and are inbuilt within a lot of the platforms that we're using nowadays. So I think there's an advocacy and technical digital literacy sort of piece there as well.
I mean, I think it's a really great question, and yes, I totally agree with you, Andrew. We've got a long way to go. I think first and foremost, we should be talking with community leaders, and I know there's some work that's been doing through Odyssey multicultural programs and others, doing some research and focus groups with religious and community leaders to understand, because it's more than language when we're talking about different cultural and linguistically diverse communities as well. So I think we really need to be guided by those communities, and yes, I think translation is definitely part of that, but sometimes things can be lost in translation as well, or it's different cultural norms. So I think it's really important to be guided by those different cultural groups.
I absolutely agree with everything. And I guess the only thing I'm thinking of adding is that once again, it's about the conversation with the person that you're seeing and with their loved ones, their carer, their family. What matters to you? And so really looking at what is important, and flagging that language does have an impact. And I don't pretend to be an expert in culturally and linguistically diverse backgrounds, so absolutely need to go to those communities to find it out. But once again, for me, it's that core thing of what matters to you. That's the important thing.
Yep, perfect. Really well said. Really appreciate sort of the acknowledgement of engaging with relevant community groups, once again, centering their lived experience and their culture. Mary, what would you like to add?
Actually, one of the things that I really resonates with me with that particular comment. I think it's a great comment, and there's a lot of work to do. And I'm actually very heartened to hear that there's an Aboriginal group looking at this issue within that community. And I think we probably, need to repeat that process and support that process as broadly as we can. The part here that is how do you communicate this to family members? Because I think that can be the most difficult thing is, and for me, that's the most difficult thing is how do you, it can be very hard. Your family, you have like very entrenched relationships with your family almost, I guess I would say. And I think for me, I don't necessarily try to correct my family a lot. I try to provide an example for them, probably more than I try to like educate them, because I don't know how receptive they are for me on that. But I'd be really interested to hear how other people approach that, because that is a really tricky one, is trying to, because they can have a very strong idea of who you are as a person, and getting them to change that can be a really long haul undertaking. And getting them to change language can be, they're like, it's a very interesting dynamic that's quite different from a professional one.
You're absolutely right, Mary. It's a very different thing for me saying, in my position of privilege as a clinician, it's a very different dynamic as compared to being someone that has lived and living experience, talking about their lives with their families. It's entirely different, I think.
Thanks for acknowledging that. I appreciate that, Mary. I don't know why, but it just made me think of, I guess, as a person with living and lived experience, but as well as a person with a clinical background, I'm just like, maybe I'll just print off the language matters and give it to them as a birthday present. Maybe that's the way we deal with family.
With a little
May
gift of
we-
Nixoid on the side.
Exactly. May we get creative with our present and gift giving. All right. I'm mindful it's the last sort of 10 minutes of this webinar. If the audience member had any other questions, otherwise, I guess I will slowly begin the wrap up.
There
Any...
was one here from Jennifer.
Yeah,
In the Q&A.
perfect.
I'm curious what the process was of developing the Language Matters guides. How did you discover and define what language was preferred?
Perfect. That's a really great question. I might actually throw that to Rob and Mary, because you kind of spoke about the history at the start. Would you like to touch on that, Rob?
I mean, I'll start and then I'll hand over to Mary. I mean, I think what I mentioned at the start was that we had a starting point because we had an adaptation from the US and New Zealand to kind of look at. So I think that was kind of the starting point that we used to do the focus groups with AOD workers and with people with living and lived experience. So that kind of created the framework for us to guide that discussion. So that was obviously really useful to not start with a clean slate, I guess, in some way. And just contextualizing it for New South Wales, I think was, in terms of what the experiences of people who use or have used drugs in the context of where we live. Mary?
Yeah, and I want to acknowledge Fiona's work on this again. She was much more directly involved in it than I was at the time. But there were like a series of focus groups, and a lot of them were with people with lived and living experience and workers, and that was kind of the process which we got to the use, don't use. I mean, it was a fairly long development process for memory, and there was a lot of care put into it, and even revising it has been we've been talking about it for probably 5 years, I think. But that was, which you were involved with, Angie, like it's there has been like a great deal. I mean, it looks very simple, this thing, the Language Matters Guide, but it has involved actually quite a lot of work has gone into it over the years, and even recently in revising it, even though the changes are like more at the level of tweaks than whole scale revision, I guess I would say.
Yep.
There has been like quite a detailed process that's gone into it with a lot of consultation.
Yep. Thanks for mentioning
Definitely.
that. Yep.
Yeah, I just also want to acknowledge, yeah, I mean, Mary talked about Fiona and obviously Cian, and Fiona worked really closely together, but yeah, also Angie and Alice and Jen and Michelle who've worked in the revision as well. So definitely need to be acknowledged for the work that they've done in consulting with people to land where we are today.
Thank you for mentioning that, Rob and Mary. Yeah, I was just going to kind of answer to that audience member's question as well. Even though it seems like really minor tweaks for version 2, we have always centered living lived experience community members. So we did have consultation group, focus group. There was quite a few rounds of it. We did all the edits and we also sent them back out for further review. So there was a lot of process and voices sort of involved in that process. And even though it may only seem like a word here and there, it was very thoroughly thought through. So yeah, it's always a committed process to the work. I have 6 minutes left and I'm going to try squeeze this question in because why not? Living on the edge. Hope everyone will get out of here at 3 p.m. I'll try my best. Question from Andrew, which is working in rural area, I would love to see education delivered to medical services in the area. Any plans to help facilitate that happening? There's a noticeable difference in language they use in the city versus rural area. I see you nodding, Hester, so I might pass this on to you.
Certainly in the local health districts, we've got the clinical care standards that are being rolled out, and certainly language matters is part of that. So there's training that's going on. Trainers who've been very involved in the clinical care standards are going out and training other trainers so they can take it on in their local areas. So it certainly is something that we're very aware of in terms of clinical care standards, and certainly in terms of the single digital patient record. If we're talking more generally, I can't talk to NGOs, I'll leave that for Rob, but certainly from a primary care setting, general practice setting, there's been quite a lot of work and continuing work to help embed the Language Matters tool for GPs and for practice staff. It's an ongoing thing. It feels like it will never end. I don't think it can. You know, you've got new people coming in. We've got enculturation, and we've just got to keep working at it. But NGO setting, Rob, I can't speak to that, I don't think.
Yeah, look, I mean, I think there's definitely a lot of similarities, and definitely we do know that, you know, regional rural communities do communicate differently to people in metropolitan areas as well. But I think some of the basic principles of what we're talking about apply regardless of the location. And I know, you know, Esther just talked about the clinical care standards, but I think that OD care charter is probably something that's really important. And we talked about, you know, we're not just talking about the AOD sector, we're talking about, you know, other health and social services as well. So I think the AOD charter is something that should be more widely promoted across, you know, the health and hospital and social services systems.
I would mention in this context is that there's also a lot of work that is happening with the Pharmaceutical Society, for example, and the Pharmacy Guild. We've worked with particularly the Pharmaceutical Society on a training package, and we you know, we do kind of stuff with them regularly. So it is like, I wouldn't say that it's you know, it's a little bit harder to access than if you're in New South Wales Health, for example. And in those settings, but it is kind of making its way through various professional groups and being taken up more and more, which will hopefully. And the other thing is that we have, and not just us, but us and other organizations do have peer workers that go out and work with local communities. We do that more in the context of Hep C testing than AOD work. But we go out, you know, we've just spent a lot of time in Murrumbidgee, for example, in Wagga, Griffith, Narrandera, communities like that, working with local services, AMSs, etc. And that I don't know that we're out there promoting Language Matters, but we're promoting you know, we're giving an example of lived and living experience workers out there making a difference in the community, which is quite powerful and important as well.
Great. Thank you, Mary. Any final contributions, Kate?
I think if we look at, the previous version and this version of the guideline, the common denominating factor is that it's just speaking to people like they're human beings. It's not centering, a problematic behavior or an experience. It's centering that individual and trying to understand each part of that, not just the presenting concern, which I think we sometimes lose sight of as services, is that, we're supporting someone in a particular moment, but at the end of the day, they're still a human being, and this is still just a part of their bigger, broader experience.
Thank you for that, Kate. I really appreciate it. I feel like that's a really beautiful note to end on, remembering and centering the people that we're actually supporting, people with living lived experience. Appreciate that. 1 minute to go. Okay, I just wanted to mention some of the resources again. Language 2, version 2 of Language Matters. It's up on the NADA website, up on the NUAA website. We posted it in the chat. Please download it. Please spread it far and wide. Gift it if you like. Just an extra suggestion, please do so. Mary also just now mentioned the AOD Care Charter. That is also a new framework that has recently been published. Have a look at that if that is of interest. Another resource that is great. This will, as mentioned, first time we've done a collaboration webinar between NADA and NUAA. We will send out a survey link after this session. So if you've enjoyed it, please fill out the survey link. We would love to do more collaborative webinars, but either way, please feel free to fill out the survey link anyway. For any upcoming NADA events, please go onto the NADA website. For any future events that you can register for. In terms of NUAA, please feel free to look on the NUAA website. We have our Peers and Consumers Forum coming up in September, which is a conference, 2-day conference that is grounded in living and lived experience with lots of different panel sessions. So please do check that out as well. Once again, thank you all audience members. Thank you speakers, panelists for joining us today. Really appreciate all your insightful contributions. And for the audience members, I hope it was meaningful, insightful. Travel gently, travel safely for the rest of the afternoon and the week.
Thanks, Angie.
All
Did a
right,
great
thank
job.
you all.
Angie.
Thank you. Take care, everyone. Bye.
Bye.